My name is Richard J. DiStefano, MD. I'm a spine surgeon, Syracuse orthopedic specialist. So I grew up in a small town called Tupper Lake, New York. That's up in the Adirondacks in the Tri-Lakes region. So I went to college at Yale University, where I majored in chemical engineering. And after school, I worked for 3 years in industry as an engineer. Then decided to go back to school. Went back to St. Lawrence for a year to get my pre-med requirements, and then went to med school at Upstate. As I went through my training, the thing about orthopedics is bone heals, soft tissue scars. Mother Nature's on our side. So really I went into spine because I want to do more than less. So actually I was more of a general orthopedist. General orthopedist doing everything and doing spine. And so just over the years I've kind of, as we all do, kind of narrow ourselves into one specialty, so narrow myself into spine. What happened with your training, because you do 4 years of medical school, then you use a 5-year residency, orthopedics, which the first year is usually kind of internship, general surgery, where you do general surgery, plastic surgery, pediatric surgery, cardiothoracic, heart surgery, do all the, Then you do 4 years of orthopedics, and in that 4 years of orthopedics, you do everything. So you do spine surgery, hand surgery, joint surgery, sports surgery, everything. So you kind of get trained in everything. And the way things have evolved over the years is most people will do then a fellowship to kind of subspecialize. Well, each patient, and this is kind of a cliche, is an individual. And so you have to take kind of the whole spectrum of kind of the person themselves, what their complaints are, and kind of marry that with the diagnostic testing to figure out what the problem is, and then how to best address that problem. As you know, we've opened up a new surgery center in April 2019, and that's been tremendous, especially for me. Because what's tremendous about the surgery center is you're dealing with a staff there that is focused on orthopedics, and it really increases efficiencies, I think, and the care that's delivered. So spine is very, the nervous system, it's supposed to work. It's like wiring in your house. So if something's not working, you can pretty much figure out where the problem is, which is kind of like spine. So you can kind of figure out, where the short is and what's causing the problem. So I think engineering has helped in general with that aspect, the analytical thinking, but also reason orthopedics is kind of a, mechanical engineer type background where you're dealing with forces and stresses and implants and different things. So probably the favorite job about my job is helping people. We all have lots of forces outside forces that, that affect things, insurance companies, hospitals, different things, but probably, the core value, which I think keeps us going, is caring for the patient, helping people. I always knew I was wanted to come back to Syracuse, because I have an older brother here, who's a lawyer, older brother. And when my mother was alive, I was in Tupper Lake, which is not too far, so I was going to come back to Syracuse. So as far as my free time, the little that there is, spent probably with family and exercising. Of course, I'm obviously of Italian heritage. So I do like Dominick's and Vito's, especially if you go there, get their hot impasto. It's really good. It's a combination of some eggplant, and then it's almost like a cioppino where they got some mussels and clams and shrimp in there and kind of a seafood type sauce. It's delicious. Living here in central New York, I do like all the seasons. So I used to ski a lot, not so much anymore. So that's for the winter time. Kind of spring, summer, I golf a little bit. In the fall, I just enjoy the fall, the leaves. It's beautiful.